As I review these two radiographs, which were taken from an intravenous urogram series, I first observed the images are from a skeletally mature female patient. The radiographs were acquired at 20 minutes and 80-20 minutes post-contrast. My immediate attention is drawn to the right kidney. I note that the pelvic-calyceal system is significantly dilated, and there is evidence of calyceal clubbing. This dilation could obscure any calcifications that might have been visible on the control film, which I would typically review as part of the standard imaging assessment. The right renal outline appears dense on both radiographs, which suggests the presence of a persistent nephrogram. No contrast is evident in the right ureter on the 20-minute radiograph. However, I can see that contrast is present in the proximal and mid-ureter on the later radiograph, and the ureter appears to be of normal caliber. The left renal outline is largely obscured, although I can faintly see contrast within the pelvic-calyceal system and proximal ureter on the 20-minute radiograph. Given the faint visibility, I might consider acquiring additional imaging, such as conventional tomographic views, if there were clinical concerns regarding the left kidney to ensure accurate assessment. There are also clips projected in the pelvis, which are most likely sterilization clips. Additionally, there is some tubing projected over the right side of the abdomen, whose origin is uncertain but likely lies outside the body. In summary, the most significant finding here is the persistent dilation of the right pelvic-calyceal system without evidence of ureteric dilatation. This imaging presentation is most consistent with a pelviureteric junction obstruction. Although no definitive cause is demonstrated in these images, the clinical situation would warrant further investigation, potentially including a urological referral and possibly additional imaging to rule out any obstructing calculus at the pelviureteric junction, particularly if this is a new diagnosis.